Hi, my name is Akemi Lopez, and I'm going to be talking about the Caritas process number 4. The fourth Carita process is all about authentic, caring relationship building and is concerned with deepening our humanity. It is about being compassionate, aware, and awake to our own and others' human dilemma. That's per Jean Watson. The quality of the relationship we have with another person is a representation of how effective our care is. Developing and sustaining a helping, trusting, caring relationship. This Caritas process focuses on relationship-centered caring. There are multiple layers to a relationship: practitioner to self, practitioner to patient, practitioner to community, and practitioner to practitioner. Practitioner to self. For me personally, I work in surgery, so I mainly work as a circulator. I work alone. I'm the only nurse in the room during a case. I have a lot of autonomy and responsibility that is given to me to care for the patient and make sure the case starts off well and ends well. Since I don't work with anyone else, I have to reflect on my own nursing practice in theory and how I take care of the patient and make sure that I'm doing the best job possible. I'm the only person that keeps myself accountable for what I do. Practitioner to patient. It is of the utmost importance for me to build a trusting relationship with my patient before surgery. Patients can become very anxious before surgery, especially if it is their first time having surgery. Creating a strong, trusting relationship with them helps put them at ease and assures them that I will do everything within my power to keep them safe during their surgery. Practitioner to community. My hospital is a nonprofit organization, therefore we do everything in our power to make sure patients are happy with their care we provide. We rely on the donations of the community and some of our patients make to keep our doors open. Practitioner to practitioner. I must maintain a strong relationship with the other practitioners working with me to maintain a good workflow for the day. I must be able to communicate properly with both the surgeon and anesthesiologist, otherwise there could be issues that arise from a lack of teamwork and communication. In surgery, we are expected to all work together to provide the best care possible for the patient. Without strong relationships in all aspects of the patient's care, there would be no trust and important aspects of the patient's care would be missed. The importance of a caring science. Studies show that patients with stronger relationships with their nurses and providers have better recovery outcomes and emotional and spiritual well-being. Some of the effects patients can experience when they are shown a non-caring relationship are feelings of humiliation, fear, helplessness, alienation, and vulnerability. That's per Jean Watson. Without caring or meeting the Caritas process, nursing would stop being a functional profession. In my practice, before each surgery, I meet my patient and ask them a series of questions related to the surgery that they're going to have, but before I'm done with my assessment, I make it a point to answer their questions and ease any of their concerns they might have. I take the time to get to know them, and if they have any cultural or spiritual needs, I make a note of that as well. I end my assessment by assuring them that I will take good care of them during the surgery. And I also walk them through what will happen when I bring them into the operating room. I find that when I take the time to get to know my patients and meet any of the special needs that they require, whether that be spiritual or cultural, they are calmer when being brought into the operating room, as well as more trusting of me as their nurse. Next, when working with my team, I communicate with each member the patient's needs. I start off by explaining any of the patient's allergies or limitations in their range of motion. Then I meet with my surgical technician and physician's assistant to make sure we're all on the same page about the surgical case we're about to perform, and I make sure I ask if there's any special equipment or supplies that they might need. This lets them know I am just as prepared as they are for the case and makes them feel confident in my skills to manage the case. I will next speak to the anesthesiologist. and make sure they are still in agreement about the surgery being performed on the patient. I also review any pertinent data with them, like labs or prior medical history. Anesthesia relies on me to help put the patient at ease and assist during the intubation process. Without trust between us, the delicate intubation period could go awry. Lastly, I follow up with the surgeon to make sure the proper consents for the surgery they're going to perform have been signed and that any important equipment or implants are present in the room. And finally, I'll verify with them the positioning that they need for their patient. Surgeons place their confidence in me that I will meet their needs along with the patients and the rest of the team for the case to run smoothly and have a positive outcome. And these are my references, and thank you for your time.